I'm Lisa Kleinbub, Executive Director of Regional Center of the East Bay. And if you don't know, by education and training, I'm also a registered nurse. So some of this probably is a little bit more accessible to me than others. And also presenting is going to be the Regional Center of the East Bay Clinical Director, Lucy Ravello, who is actually more in the day-to-day knowledge of many of these things. But thanks for joining us. And I will say that with COVID-19, everything is always changing, and we're finding out new things, and people are changing their processes from day to day. So what we know today isn't necessarily what we know next week. So in Alameda and Contra Costa County, our numbers have really been rising since early November, which wasn't actually unexpected as we went into the winter months. However, the Thanksgiving and December holiday gatherings have impacted the spread. And while there were a lot of directives to not gather in homes and with people from different regions, people still did, and there has been spread of COVID-19 as a result. Hospitals are also really being impacted with very few beds available in ICUs. In our region, we are a little better off than in Southern California, where hospitals are at 0% capacity and things are much, much more severe in that part of the state. Statewide, I'll just show you some numbers. 7,249 cases among regional center people served. About 2% of our population statewide has had a diagnosis of COVID-19. And the population breakdown by ethnicity has broken down, I would say, mostly in accordance with percentage of regional center population, with some groups much lower, though, and one group much higher. Among our Asian population, statewide has had a lower rate of COVID than you would expect based on percentage in the population. The Latino population, slightly higher. And among whites, much higher than what you would expect because of the population. I think there's some reasons for this, which when I get to our East Bay numbers, I will tell you. I do think that we are not always getting all of the cases reported to us, specifically for people who are living at home with their families. They may not tell us until far after they have the infection. At Regional Center of the East Bay, we have 280 clients as of data as of 12/28. It is more in the 340, 350 range right now. We've had about 1.3% of our population has tested positive. And I think that what we have seen in this area is the population that has the highest percentage of COVID-19 we know about is the white population. And I think some of this relates to age, because we are seeing COVID-19 that we know about in places like residential settings, and our adult population tends to be more white, and our Latino population tends to be much younger. So that may be why we see less than what we would expect based on our population among those demographics. Statewide, I'll show you where people are contracting COVID-19. And as you can see, there are facilities where the rates of our COVID-19 are much higher than what you would anticipate. So people in intermediate care facilities, a type of licensed facility, have 2% of our population, but 13% of our COVID cases. And 7% of regional center consumers live in licensed residential care. That is where we have a very high percentage of our COVID cases. While SLS, ILS, and family home agencies represent 8% of our population, it's only about 12% of our COVID cases, which is really low, and that is probably because there are fewer people in and out and fewer other people who expose people to COVID. Similarly, for people who live in their family home, a much lower percentage than what we would expect. And so it is mostly the people who live in congregate types of settings who are exposed to multiple different caregivers who are still testing positive for COVID-19. I'm going to talk now about testing. People should test for COVID-19 if they've had close contact with anyone who has tested positive, if they have COVID-19 symptoms, if they're told that they may have been exposed to someone with COVID-19, and if they're at high risk, even with no symptoms, like they live in a congregate care setting, they work in healthcare, a congregate care setting, a prison or jail. In California now, with residential facilities, which are licensed residential facilities, testing is required. They must test a quarter of their staff, I believe it's each week, and they're testing residents on a monthly basis. And the facilities are responsible for contracting for tests at home in their homes so that they can meet this requirement. And they've been doing this since December. They were required to have all their initial tests done by December 26th. And I think this is a repeat, but you can look at it if you go back and look at it as well as to who should be tested. And this is a slide with finding testing resources online. And all of these include places you can go and get tested. And waiting for testing can be 2 or 3 days. The recommendation for getting tested if you've been exposed is at least 4 to 5 days after that exposure. You should quarantine until then, because you want enough of the virus to have been built up in your body if you are testing positive. So there is a little lag time on when you should wait until you get tested. But these are good resources for finding testing. And I will say that my experience has been it's 2 days at least to get test results back for the type of test that really is considered definitive. Hospitals and other settings use a quicker test, but it's not as accurate. And they always do one of the tests that takes longer as well to complete that. What is testing like? Many tests are performed by licensed staff using an FDA authorized nasal swab. Testing sites use a swab test that is less invasive than it was as when testing first started, and it's really not painful at all. You're asked to pull your face covering down to keep your mouth covered, but to expose your nose. And at many sites, staff hand the swab to you, ask you to place it just inside your nostril, and they swirl it around for 15 seconds and repeat on the other side. There is really, in these kinds of settings, no more swabbing of your throat, which was really uncomfortable. And some newer models of testing do not require that clinical staff actually do this, observe the swab, but rather non-professionals who've been trained are able to observe the self-swab. And there's also new home tests coming soon where going to a test site will not be required. And in the future, and when I say future, probably the next 3 weeks, 4 weeks, we're working with the state to increase the number of self-administered COVID-19 tests. These would be tests that can be completed by the individual for themselves with support guidance from trained non-professionals and some observation. And our hope is to have the test available so that individuals, caregivers, support persons, family members can complete this close to home within the next few months. So we're really hopeful for that. And I'm saying a shorter period of time than a few months, because it is important that if you test positive and you're able to quarantine, you keep other people from also being exposed to the virus. And now I'm going to turn it over to Lucy Ravello, who is going to take you through the information on vaccines. Thanks, Lucy.
Sure. Can you hear me okay? Okay. I'm a nurse and I'm our clinical director here at Regional Center. And I've just, as many of you have, been looking at all of this information and hearing from our community quite a bit over the past month, I would say, about, I know there's lots of questions about vaccines, and I'm really just trying to give you a good overview and not overwhelm you with details here. So that's the intent of this presentation, at least. So I know safety, just wanted to start off with there's a lot of concerns about the safety of the vaccines. And I know that that's a priority of the state and the feds and all of the developers of these vaccines. It's really important that what we're giving to everyone is going to help and not hurt anyone. So that's just to let you know, that's the major priority, is to make sure that they're safe. And that's why they have to go through so many different phases of testings and trials. And I just heard from a provider of ours that was part of a trial. So that's exciting. I don't know of any of, I haven't heard that from anyone else, but I know that that is part of how they make sure that it's safe to give to people. And the vaccines are meant to help protect everyone from getting COVID-19. And I know that there's a lot of talk about new strains of the virus, and the intent of the vaccines is to protect people even against new strains as much as they can. I think the scientists kind of anticipate that viruses like this may change over time. And that's kind of tricky part of fighting a virus like this, is that it may change, and their goal is to provide broad protection against the virus with these vaccines. So the current vaccines that are available to us are, I'm going to talk a little bit about in the next slides, but they're 2 doses, and 1 dose is followed by another in a few weeks, 3 to 4 weeks, depending on the vaccine type. And it just has to be at least that long. It could be longer. And that'll still be okay, because they're both boosting immunity in your body and providing defense against the virus. So, and the CDC and Department of Public Health in our state are guided by a number of different advisory committees, and they're all working together to kind of make sure that vaccines are prioritized for certain populations and groups of people. And I'll talk about those phases in the next slides as well. And then this first phase that's currently just getting started here in our state are healthcare workers, mostly in acute care facilities like hospitals, and then residents of long-term care facilities and their staff. And those include, in our state, healthcare facilities such as nursing homes, but also smaller facilities such as intermediate care facilities and community care facilities, residential facilities. So I think I'm ready for next slide. Yeah, we're working together. Oh, I mentioned in the slide that we're trying to work very closely together with our 2 counties, Contra Costa and Alameda, to ensure that all of our facilities that we have people living at are included in that distribution of vaccines, this first round of vaccine distribution. And the reason there has to be phases and prioritization is because the vaccine supply is very limited right now. And we wish it was better, but I think we were anticipating millions of vaccines to have arrived in our state already, and we're a little short of about half of the supply has actually arrived and is being distributed. So that's quite a difference, and that's going to cause a little bit of a delay in how quickly vaccines can get out to people. And it also causes the counties to kind of recalibrate or kind of reassess how they triage and how they give them out and who they prioritize them to. So it's kind of, I think it's the federal program was initially called Operation Warp Speed to provide these vaccines to everyone in the country. And it's not quite warp speed, I wouldn't say. I don't know that any scientists would say that either. I do know that the vaccines initially have been provided to the larger healthcare providers of acute care, and then also counties are getting the vaccine from the state and from the feds. So I know there's lots of questions about when will we be next, and when I think the counties and the state are trying to estimate when the next phases will be rolled out. They don't have to wait for one to be completed before starting another, but it does depend on the availability of the vaccine. So that's kind of where we are. So it has been slow, which is frustrating because I know everyone's very anxious to have access to these and to start their vaccination process, but well, maybe not everyone, but a lot of people. And I hear often from providers and clients and families of when can we get this? But that's the point of our presentation, to kind of give you some info about what we know so far. So they're trying to get more vaccines into our state and our counties every week, and that's coming along. And hopefully soon there'll be more vaccines approved and even more vaccine availability. So next slide, Lisa. And here's where we talk about the phases, and hopefully we'll answer some questions. But this is from the state. I've pulled this information from our state COVID vaccine task force, our work group. And so this is a very generalized overview. And then each county has all of this info posted on their websites as well, because they have, each county's public health department can add in tiers of more information about which phases and who's included in each phase, more specifically. But phase 1A is what I mentioned earlier, where healthcare workers in hospitals and then long-term care residents, through a partnership with the federal government and the CDC, CVS and Walgreens are the pharmacies that were contracted with the feds to provide vaccines to all of the residents and staff in these long-term care settings. And I do know that probably starting next week is when a majority of these vaccines will be getting out to our clients that live in these homes, because we've been getting several consents for the vaccines sent to us to review for folks that are not able to provide their own consent or have no family to do so. So we have been seeing that, and we've heard from providers also that some have been scheduled and maybe some have been given, and I'm not aware of that as well. But I think certain parts of our counties are more ahead of other parts. But generally, over the next few weeks, these pharmacies will be providing these vaccines to residents in these facilities after they've mostly immunized or vaccinated the folks that work in the hospitals. So then in Alameda and Contra Costa counties, in-home support staff and workers are considered to be part of phase 1A. They may be in different tiers depending on which county you're looking at and working in, but they are part of that group of healthcare workers and direct care staff. They're tier 2 in Alameda County. I believe they may be around there in Contra Costa as well. And then we go on to phase 1B, tier 1. There's several different tiers in 1B, but 1B includes people that are older than 75 that work in high risk settings and or they have a lot of chances for exposure to COVID in the community. So they could be teachers. I think we've heard a lot about that in the news recently with schools kind of pivoting, reopening, or waiting for this before reopening. Childcare providers, emergency service workers, and those that work in food and agriculture. So anywhere from grocery stores to farm workers. I think that's, yeah, ready for next slide. And then we go on to 1B tier 2, and that talks about people that are a little younger, 65 to 74. Those that are at risk of exposure in their work and transportation, I list them there. And then there are also folks that live in other congregate settings, maybe that weren't included in the first phase 1A. And then I've also recently heard that there was some changes to the state grouping where folks younger than 65 with disabilities or any kind of co-occurring health conditions would also be added to this group 1B. So still first phase, but this is 1B. Does it go on? Yeah. And then phase 1C includes these even a younger group, 50 to 64, and individuals 16 to 64 that have underlying health conditions and disabilities, as I just mentioned. So these phases will likely be overlapping. They won't stop and start at specific times. It all depends on how many vaccines each county has to distribute in this way, but this is their guideline of how they're going to invite groups to get the vaccine if they choose. So this is not, at this point, this won't be mandatory vaccinations that are happening because of the limited supply. We can't mandate that any group receive the vaccine. We are just, as public health nurses and the health officers in each county, we're strongly recommending that folks, if they're able and willing, they receive the vaccine, especially if they're in high risk populations or in their profession that they're exposed to folks that may or may not be ill with the virus or have the virus. I think it's important part of vaccination, I think, is that a lot of people don't know that they have the virus and they are infected and they are contagious. So that is a tricky part of battling this virus. That's why the vaccine is considered to be one of the major ways that we can fight it, is because without knowing, people are contagious and sharing it if they're not able to follow guidance to stay home or wear a mask or keep distance. So I think, anyway, that's part of why this is an important process, is to get people vaccinated. I think, I'm not sure how many, is there another? Yeah, I think that's it for the phases, but it'll be extended eventually to the general population. I've heard from the state calls that I've been on that will not likely happen until late spring to summer, where the vaccine will be more widely available and we won't have to juggle who is prioritized next. So I think eventually, as much as we can, we'll focus on folks that are in high risk areas for vaccines, and then it'll expand through healthcare providers and be more accessible. So hopefully it's good to know that is in our near future, even if it's not right now, it'll be soon. And then I just want to talk briefly, I don't want to keep everybody for too long. I know this is a lot of information, but vaccines, we talked about both vaccines have had very rare folks have allergic reactions to the vaccines that are available now. And those are folks that have other severe life-threatening allergies, and they've had, luckily, the stories that I've heard of people reacting, they've had EpiPens or epinephrine available, or they carried it with them. And within a few minutes of getting the vaccine, they knew that they were reacting and were able to either themselves medicate with an EpiPen or have someone nearby who could help them with that. And that reversed the reactions and they were okay. So I haven't, through my studies or research, I haven't seen any adverse reactions that weren't reversible, which is good news. But that's part of why in the consent for the vaccine, people, the pharmacy or the public health department will want to know about your allergy history and whether you've ever needed medication for allergies, severe allergies. And this slide just talks a little bit about side effects, but I'll go into that a little bit later with the next slides, I believe. But an important point too at the bottom there was just that COVID vaccines cannot give you COVID. They're not live virus. They are an mRNA, a messenger RNA, and it's detailed, but it's pretty much a pseudo virus. It's like a faux virus. It looks like a virus, so your body thinks it's the virus, and it goes after it and builds up your immunity to it, to the virus, just as if you had it. So it's not giving you any illness that your body can't fight. They're two doses, as I mentioned earlier. They're given, 21 to 28 days apart. And then let's see, Pfizer and Moderna are the two vaccines that are currently available to us in our state. And here's some side effects. I won't go through them, but there's similar. There's soreness at the site of the injection, and you may feel a little tired, have a headache, have some muscle pains, chills, joint pain, and or fever. Most of these symptoms are mild, and they will probably only last a few days. And I've read that it's more often that these side effects occur after the second injection, if at all. Some people won't experience any of these side effects from the injection. So, and then another important note is that the Pfizer biotech vaccine is only approved for people over 16 years old. And then the Moderna is approved for those that are 18 years old and older. And I know that they are working on, maybe in the next slide, it talks about some of the newer vaccines that haven't been approved for use yet in younger groups of people. So I know that there's work being done probably around the clock to develop more vaccines for all of us. So I mentioned earlier that vaccines are an important part of stopping the pandemic. They aren't immediately going to protect anyone. However, it'll take a few weeks for your body to develop immunity to the virus or protection against the virus. After the first and second, the best protection is after the second vaccination in the series. And until we've all built up this immunity, we have to continue to follow our current way of life, and sheltering as much as we can, staying home, staying keeping distance away from others that don't live with us, wearing a mask, of course, a face covering is what as much as tolerated, and I've read also that the best masks and face coverings have more than one layer. Even a couple layers is safest, just to prevent anything from getting through the fabric that you're covering your face with. And then of course, washing hands as much as you can, or using that sanitizer. So I think all of these things are just meant to keep us as safe as possible until vaccines are more available, especially right now where there's such high rates of transmitting the virus, so many people that are positive and may not know, and such full hospitals with space limited and healthcare staff so limited. It's really best to avoid increasing the chances that we'll get ill from the virus or anything else, and needing hospital or medical attention. So I think, and then yes, so I mentioned real briefly that some more vaccines are in the process for folks that are younger than 16. I don't know if Lisa mentioned during the testing, but testing you can do at any age. So there's no age limit. I think maybe toddlers and up are safe to do the nasal swabs for testing. But for the vaccines, they are not approved for anyone under 16 yet. Hopefully soon. Yeah, by summer, that would be great. Is that all? I don't remember if there's another slide, Lisa.
That's
okay.
Yeah, that's the last. Okay, I'm going to stop sharing.
Okay.
And I'm going to start with answering the questions that are in the chat that we can answer, because actually your questions maybe will direct us as to some of the other things we need to talk about, and also will help you with kind of identifying some resources as well. So we will also be able to have people raise their hand as attendees if you're not able to do the chat. So we'll work on that as well. So there's a question about when people who live in a congregate setting, which is, I'm responding to Renee, will get the vaccine. And our expectation is that congregate facilities will be getting the vaccine over the next month. We know that the CVS Walgreens federal partnership is working with all of those facilities. And we have actually been able to get the list of facilities and then also update both counties and the state as to who was not on those lists that was a facility, and make sure that they're on the list and getting the vaccine. So many people who live in those type of facilities will be getting the vaccine at home by someone from CVS or Walgreens, is our understanding. If I get the vaccine, can I still catch COVID and infect other people? So this is a question that is still sort of out there. There is a recommendation that even after you have the vaccine, you should wear a face covering right now. And the reason is there's some concern that while the vaccine will keep you from getting sick, will it prevent you from having the virus, and as you're preventing yourself from getting sick, spreading it to other people during a short period of time? So we still are not certain about that, but as more and more people get vaccinated, the chances of getting the virus and having to fight it off in a period where you could infect other people is less.
Right, and yeah. I would just add that they're finding through all of their research that the current vaccines are very effective, over 90% effective at preventing you from becoming ill with COVID. So, and that's pretty good. I mean, I think they're doing their best to make great vaccines that cover all sorts of COVID viruses too. So that's the thing where I mentioned, if the virus changes a little bit, it may affect how effective the vaccine then is. But they're still doing a lot of research on that. And that's part of those trials that they put all of these vaccines through before they give them out to people, or part of the research that they do is just to make sure that they're as effective as possible before giving them out. So, but that's a good question. And also, it does take your body a while to develop that immunity, like I mentioned. So right after you get the vaccine, it's not a great time to run around without a mask or visit people that you haven't seen in a while. It does take some time. A month probably is safer after the second vaccine to really feel like your body's had time to build up a protection against that virus. So
the next few questions that I have here are about IHSS workers. Mm-hmm. So our understanding is that in Alameda County, IHSS workers are in in phase 1A, this is very confusing, phases and
I know.
tiers. Phase 1A, tier 2. And we have been told that in Alameda County, people who are registered as IHSS workers will be contacted very soon in order to get on a list for being vaccinated. So that is the first thing. I think that it will be the workers, and the questions are about when will the regional center client receive the vaccine, when will other people in that household get the vaccine. Right now, our understanding is the people who fall in these categories will be the first to get the vaccine. And then the others will get the vaccine when they fit in another category. I'll talk a little bit more about regional center clients in a minute after I asked her a few of these questions. In Contra Costa County, there is actually a place on their health department website where IHSS workers can sign up for the vaccine and do that. We have also, and get on the priority list for that. There's a question about respite workers. We believe, and from the state guidance, people who are providing personal care, that kind of direct care, should be falling under healthcare workers for many of the categories for our service providers. And so we have actually sent out and will be distributing to all of our providers who provide other than the residential type services, how to sign their agencies up with their workers who provide direct service. It shouldn't be that people who are like working in the office and not working in contact with people who are at high risk for getting the virus get the vaccine first. But the people who are the direct workers should be considered. And according to the direction we've gotten from the state, people who are personal care attendants through the regional center should be considered healthcare workers. Funding for many of our services to individuals comes from Medicaid. And so we are healthcare workers in many of the things that we do. And so I think that will be rolled out and we will be able to do that. So that's sort of the guidance. We don't have all the specifics, but what we are planning to do is that we are going to create a separate section on our webpage devoted to testing and vaccination. And with that, we'll update that all the time. And we're going to ask our case managers to make sure that we share that with them, with their families, so that everyone knows. I think that it's going to be a few months until we have broad coverage, but I guess I'm optimistic. If IHSS workers are considered to be important enough to get the vaccine, shouldn't the clients they serve be able to get the vaccine? I think that there is a strong belief among advocates and all of us who are advocating on behalf of individuals with developmental disabilities, because of the conditions that many people have and some of the more recent studies, including the CDC placing people with Down syndrome as a priority category for the vaccine, that they should be prioritized. Right now, the state has not prioritized people with intellectual and developmental disabilities in those categories, so we can move forward. Amy asks, are RCB clients considered 1C? So if they're in the age groups for 1C of people with chronic conditions, I think many of our consumers will be. We also have many consumers who will actually be considered higher up in those groups, who are people who are working in competitive employment. Actually, quite a number of the people who are our consumers to who are working in supermarkets, other retail, are actually getting COVID-19 at fairly high rates. Okay, Lucy, can you answer this? What is RCEB doing to advocate for our clients to get the vaccine if they want?
I think, well, we're advocating on a local level, and then also partnering with our State Council for Developmental Disabilities. They're doing a lot of work with a number of other agencies to advocate on a state level. I was just on a call earlier this week, and there was several letters and several petitions to enhance, move the folks that we serve and support up on the list of prioritization for the vaccine. So I know that there is quite a bit. I'm back and forth with our county health department. So is Lisa. I mean, almost every other day, if not daily, we are back and forth with them about how can we get this out to more people and quickly. I think it's all a balance because of the distribution of the vaccine has been slowed down, and then just trying to organize who gets what and how to get it out there. So there's a lot of little details that we are working through, but we are definitely advocating, as much as we can to get more folks moved up on the prioritization list. Hopefully that answers your question. I know there's a lot of statewide activity as well, and advocacy. So
yeah, vaccine distribution is an interesting process. I think we mentioned that in one of the slides, but the congregate settings like the group homes and stuff are mostly going through a federal program. And then the vaccine kind of gets sent to the states, but really the rubber meets the road at the county level. And so a lot of the advocacy that we're doing is, advocacy, we have a lot of partners in our counties, and we have many people in the counties who are advocating for people with developmental disabilities as well. So I would say it's a partnership of advocating to make sure that our people who are most at risk are moved up on that list. And family caregivers are probably people who should also be considered as a caregiver and as providing some sort of health service as well. So I think it's complicated. I think though, one of the best problems to have though, is to have more people interested in this vaccine, because initially there was a lot of concern that people wouldn't be interested in getting the vaccine. So there's something positive about that as well. And in the next couple of months, we should see AstraZeneca's vaccine approved in the US, and we're hoping that a Johnson & Johnson vaccine, which is in collaboration with Johnson, it's a European company, also comes to market and is approved. So I think both that will actually increase the supply. And then what's the liability to a licensee if someone has a reaction? I don't think a licensee of a residential care facility has any liability for the vaccine reaction. The reaction to the vaccine, to these two vaccines that has been seen is kind of this initial kind of allergic reaction. And then that's why they want someone to not just be alone after getting the vaccine. So someone can watch them.
Right.
For someone who has tested positive for COVID in the past, can they get the vaccine? Lucy?
Yeah, actually, Lisa just asked me this question. We've been talking about it. Yes, it is recommended, even if you have had COVID, and whether you've been sick from it or not, that they still recommend getting the vaccine if you have the opportunity to, and when you have the opportunity to, because it is believed, but it hasn't been thoroughly researched since all of this is moving so quickly, but that the immunization, the vaccine's immunity boost will last longer than your own antibodies to the actual infection. if that makes sense. So they aren't positive about that, but they are hopeful that the vaccine will protect you longer. Let me say it this way, protect you longer from getting COVID, sick from COVID or a variant of COVID after immunization versus a natural immunity from becoming ill from it. So that's a great question, actually. There's a lot of research being done on that too with all the new vaccines as well as the current ones. So it's hopeful that it'll last a good long time, but they don't even know how long the immunity will last from the vaccines.
So the next couple of questions are about people who don't want to take the vaccine. And there are definitely people who are concerned about vaccines and their personal health history. There are people who believe that that they shouldn't have to take a vaccine. There are other people who want to see a lot more people get the vaccine before they take it, and so forth. Now, I do know from what I've read about these vaccines is while they were brought to market pretty quickly for a vaccine, actually, if you recall H1N1 many years ago, another pretty serious virus, the science to develop a vaccine for that was part of developing these vaccines. And there had been a lot of studies been going on for these type of vaccines for many years. So the scientists actually had been working on these. So I think that's something good about the effectiveness, that they knew a lot when they started making these vaccines. I don't think that there's going to be that people won't be able to go to different places if they don't take the vaccine. I think until there's something called herd immunity, which really means that most people are immune to the coronavirus and that will prevent it from spreading, that there will be a relaxation of rules like mask and stuff. So I don't see that as being an issue. And then someone is asking if they're, I think, have staff, if they don't want to take the vaccine, what can they do? If you are an employer, it appears that California law would allow you to mandate the vaccine, but there would have to be exceptions. And so if you are an employer, I'd encourage you to talk to whoever your employment lawyer is in order to get guidance on that. There always are people who do react differently. There's someone about severe reactions to some drugs. How can I find out the vaccine's ingredients?
I think a good site for that is either the CDC has a lot of information on each vaccine that's released, and also the FDA. So I could put links in the chat for those two sites, but that's FDA lists a lot of specific information about each type of vaccine that is available, and I think that's a really good resource. There may be others. You could even go directly to the manufacturer of each vaccine if you can find how to spell the name of the vaccine online. Even Department of Public Health would have links to all of that as well, our own state's public health. But let me see if I can find links real quick and I'll throw them in there for you to research. That's a great question.
So the next question is about when do you think community-based direct support staff that don't fall into the other categories will be able to get vaccinated? I actually think that many of the community-based direct support staff who support and provide personal care will fall into the same category as healthcare workers. So we are working on that and working on pushing for that to keep happening. You know, because of that fact that we are actually Medicaid providers through a circuitous route, it really is that many people we serve could be living in those large congregate settings that are getting vaccinated first. And so we've probably able to advocate in that way. Is there a letter with the wording for licensees to use to get client and staff permission to receive the vaccine? And
Yes,
explain
I
it.
can
Yeah,
answer that.
yeah.
Because I've seen quite a few of them. There's a consent form and an info sheet about which vaccine your pharmacy. So you're going to be contacted by a pharmacy if you're a residential care facility. We've made sure your home is listed on the list to receive them, and that you'll be reached by email or phone, whichever contact info you have. Typically, it's what you have listed with licensing, and then they will send you all that information directly from the pharmacy. So we aren't sharing consent forms because I don't want it to get too confusing. I want it to come directly from the provider of the vaccine to the folks that live with you and your staff. And they'll provide all the forms that you need. The only thing I want to say about consent paperwork is that you let us know when you receive it if there's someone who doesn't have a decision maker or a conservator, or they're not able to do provide their own consent for themselves. So we can help with those. So hang tight, and you'll probably receive it soon if you haven't yet. Within the next week or two, I would say you should expect to see that.
And the other thing is that we got a presentation for individuals served that's in very straightforward language about vaccines. And our board has a consumer advisory committee, and we're going to share that with them on Monday. And as soon, if they have feedback, we'll make some adaptations, but otherwise we'll share that also with service providers so they can use that to explain vaccines to people served as well. It's not mandatory for anyone at this point. And the vaccine, there is no virus injected. The first two vaccines work on a different technology using messenger RNA, and we will post some specific information about that, but it's quite good, actually. It's a new method. And then once you get vaccinated, how long will you have to wait to get on public transportation? So actually, there is no prohibition for someone getting on public transportation right now. Public transportation is open. People need to wear masks and protect themselves on public transportation. Actually, it's not that crowded right now, so it's probably safer than at some times. However, there are some, people will probably take maybe a few weeks after the vaccine second dose to feel like they're fully protected. But yeah. Here's something hypothetical. Thanks for asking. When do I think day programs can open? Hard to know. I think it's going to depend. I think one of the things I've been saying a lot is, by July, we should have a pretty broad-based vaccination for people in our community. And so I'm hopeful that there will be a vision of opening by the summer. And that's not actually a bad time to open because there's, it's less people being indoors. Even if there is some virus around, you can go out and all of that. I think it's going to be interesting as to see how people are going to want to reopen. One of the things is that many people have found that they want to go back to what they were doing before, but they may want to go back to it in a different way. And we may have requests for people to continue some form of alternative services a few days a week or something. So we are not sure what going back is going to look like for everyone. But as I said, there's no requirement that people be vaccinated at this point. And so that's going to also have to be a consideration. And I do know that there are some people who, given their medical condition, really feel like getting vaccinated will not be the right thing for them. And we're going to have to balance that with everything else for people. So that's going to be kind of our struggle of the next month. And we really are at Regional Center of the East Bay really trying to prioritize supporting people to get vaccines, support prioritizing getting consent signed for people who have no family members. If you're a family member of an adult and you are involved in their life, you signing the consent is fine and it shouldn't be a problem. And if they are unable to sign it for themselves. But we're really interested also in people who are served through the regional center being able to sign their own consents and actually understand what the vaccination is about. And I think many people are interested in that. So I think there's one more message. Okay. And we're going to post this on our website, and we're going to keep putting more information up, and we'll see what the interest is in having a similar webinar with updates next month. But I do know that many meetings of different groups are focused on vaccination. I do know that both our Alameda and Contra Costa DD councils meet monthly and will definitely be including these topics on their agenda. So please join those meetings, and we enjoy sharing this information with you. And we'll probably continue doing webinars like this once a month, even after the pandemic, but I'm really excited about getting these vaccines out and being able to connect with some people who've been on these webinars that I've never met in person, meeting you in person. So look forward to chatting with you again. So thanks. Bye-bye.